I am Krishnan Dharmarajan, Executive Director, the Center for Digital Financial Inclusion, CDFI, based out of Delhi. We have offices in Bangalore and Chennai also. You see, we all talk about technologies, the latest, the mobiles, the analytics, artificial intelligence, and all that in the context of, five-star hotels, sitting in large hospitals and saying this can happen, this is happening in USA and all that. But you go out into the rural areas, you see poor people, you see that even your phone does not work, you see that electricity is not there half the time, and you see so much of need for these technologies. So what do you do to actually take this to the last mile and make it really relevant and make it achieve an impact? That is a challenge, because it is not just about technology. It is of adapting technology to low resource settings. The resources are not great. Adapting technology to deliver really at low cost, because it should be affordable and it should be scalable to the millions. And that is a challenge which is unique to India, because we have a large number of people, we have their needs which have not been met for so many decades, so many years, and we also have good technology. See, we also have it. So it's a classical kind of a challenge in the Indian setting: technology capability, the need, and the real challenge is to bridge it with a nice model which can deliver in the last mile and also make it low cost with high impact. That's something I think which is quite promising, and some of our work has given us encouragement that a lot more is possible in this area. See, we have over the last 4-5 years focused on using technology for social good. Initially, the focus was more on financial inclusion and benefit transfers. Later on, became wider in the area of social good, because we found that technology does not have any boundaries. So once you develop something in a particular context, it is applicable across domains. So we help the government, develop and roll out a countrywide program for maternity benefit, which is across the country. So till date, under the Pradhan Mantri Matru Vandana Yojana, the government of India has disbursed over 5,000 crores across the country over a period of just 2.5 years. Then we also are seeing how can we use data and analytics to promote outcomes of various key government initiatives, especially at the last mile, designing government schemes. How do you use technology to do that? So that is again the same context of making technology really relevant to the last mile. That is something we have done. We also experimented successfully and scaled mobile-based models for the people in far areas, where mobile becomes a kind of a learning platform for people. We have also built an end-to-end agri-business platform for farmers, for farmer collectives. When they come together, aggregate their input requirements, aggregate their produce, and then take it to the market in a digital fashion. Can a farmer also create a professional company fully digitized and market ready, the way we have professional companies elsewhere in other domains? So that was a challenge, and we did that also, and that is a system that is now working across 35 farmer companies across the country. In addition, we have done some research which is of relevance, like how do migrant labor send money home across the country. There are a large number of such people employed in the country, so how do they send money home? So lots of research around these and similar areas. So basically, whatever we can do to see how technology can make an impact to the excluded and help them advance in their livelihoods, that has been the focus. The latest work that we have started is helping, again, the government design a data architecture for the self-help group network which is there across the country. We have about 48 to 50 lakh self-help groups. So how do you get their data right from the remotest of villages, see that it flows up in a manner through various levels of the government for implementation, for help in implementation, and also for policy framing. So this is another such project which we have started. So most of it is technology, innovation, scaling it in a way that is able to make impact on the last. Yeah, that's a very interesting question, because we actually started over a year back in one of the remote districts in Meghalaya. It's called Southwest Garo Hills. We worked an initiative with the district collector there, with the deputy commissioner there, on what can we do to improve institutional delivery, which was actually below 50%. And despite all the government schemes, government incentive programs, which basically means that more than half the women there deliver at home with all the attendant risks of delivering at home. So how do we use technology to do that? So one of the key elements there is getting data in close to real time on about expected mothers. Where are they located? When are they expecting the delivery, so that you can reach the right resources to them. This is something that we did using mobile and analytics. So the data could flow in from those remote villages through mobile phones, come in real time to the district administration, to the district collector on his dashboard, on his tablet, and he can immediately intervene and take action. So this was something that we rolled out successfully in that district, and we were able to bring take up institutional deliveries from about 44% to what is now in excess of 80%. So that is the kind of improvement we achieved in about 8 to 9 months, which is quite unprecedented. And we are actually talking about a district that is, say, 7 to 8 hours by road from Shillong, where you have a helicopter going once a week, and where connectivity is also very iffy. So it is actually working in low resource settings and still making an impact on people who are really devoid of resources, and saving lives actually. So that is something we managed to do with institutional deliveries in the Southwest Garo Hills. And looking at this unprecedented result, the state government was also very excited, and in fact a lot of support came from the government to make all this happen, and the drive and the leadership. So the Chief Minister said that let us do this across the whole state, and he announced the Mother program in his Independence Day speech, which is actually stands for Meghalaya's outcome-oriented transformation of health, education and rural development. So while the name is Mother, it signifies that the mother is at the center of it. What the state government has done and what we have helped them do is to take this concept of getting data and analyzing it and driving action, take it out of just the health domain and make it applicable across to education, to rural development and everything. So this has now become a new approach to governance, which has been triggered by the health project, which has been triggered by the impact it had on institutional delivery, but now is applicable across domains. So it's an integrated kind of a platform where everything now flows up to the CM level. He can see across sectors what is going on. And I think we are very excited. It's a fantastic vision that the state has, and we are happy to partner and take this forward. And it also helps see the connect, because when you attack health or when you attack nutrition or education, these are all not isolated domains or sectors. They all have an interplay. For example, the kind of poverty situation in a household or in the village could very well have an impact on the health, on the institutional delivery. So unless you see these linkages which are apparent from the data which comes, you really cannot make truly effective interventions. So as I was mentioning, when we have this data coming in from the ground, flowing up in real time to the district administration, to the medical officers and the deputy commissioners and all that, he is able to see, for example, in a given week, where are the expected deliveries across this district, and which are those women, how many of them are at a risk of in terms of delivery. For example, there could be second or third order pregnancies which are more risky. How many of them have other risk factors like hypertension or anemia and all that, which require interventions. He can even go to the level of seeing have the necessary medicines been given to them. Then when the expected date of delivery approaches, with the data, he can actually monitor to the extent that has she been informed about the number of the ambulance driver, who is going to accompany her to the dispensary, and further follow up also after that. So this getting the data in real time in a form that is intuitive through easily configurable dashboards which the officer can himself create, and being able to drill down and check on every expectant mother is something that has transformed the way the government has become proactive. It's no longer a reactive government. It's no longer a government that acts after 1 month or 2 months. It is a government that acts instantaneously. And we have also built other interesting features where, based on the data that is coming in, we have instantaneously alerts coming out based on conditions. So if there is a certain set of risk factors, even if the officer misses it, the system will automatically be able to trigger that and send appropriate SMS or email to the concerned officers. Hey, this is happening in that particular village. That woman is at risk. This is the past record. Please do something. So even if he is busy in the middle of something else, he can react to that and take the necessary steps. So this is actually using technology, where it is close to impact and making the administration more proactive to actual events on the ground. So what is interesting about a lot of the work that gets done in this space, in similar spaces that we work on, is anything that is done is easily replicable, and it's called scalable, because by the nature of the mobile based technologies and the cloud that we work on. So what we have done for this state of Meghalaya can now be taken to other states also, those that are interested. Some of the problems could be similar, some of the problems could be slightly different. At the same time, the similar approach can be used. So when we took it to some other district in another state, they said, okay, this is a great idea, but my problem is slightly different. So we designed something different for them. So the concept again is the same. How do you get data real time and make it happen? So we would like to take this concept across sectors, beyond health, and also further deeper into health, use newer approaches which we have already started using, like data-driven intelligence, AI, and stuff like that, to be able to predict health risks and outcomes, so that the government can take proactive steps. So expanding the scope of what we are doing, expanding the reach across the states, these are some of the things that we would like to do going forward. Whatever we are doing, it requires, it's actually a multi-stakeholder approach. We work closely with the people on the ground, with the government machinery, and the fact that people are all enthused and they are all proactive is something that creates a win-win all around. It is not just about technology, it's also about the way, a lot more about the way the administration and the governance at the highest level has adopted the technology to drive change.